Sometimes I think that people that have mental illness feel freer to express themselves.
Because we think outside the box.
I think I was creative before I was mentally ill.
People involved with mental health do have a very strong creative spirit.
There seems to be some link with creativity and art expression and mental illness, but that's not borne out well with research.
Well, what is normal though?
Anyone that sees this gallery doesn't see mental illness. They see creative, talented artists. Dr. Clayton, our medical director, really got behind it. I just always loved artwork, and so I just immediately signed up.
Brushes with Life is another name for the STEP Art Gallery. STEP stands for Schizophrenia Treatment Evaluation Program. The gallery is displayed in the halls leading up to the restricted area where the severely mentally ill are treated. Once new patients are treated with medication, rest, and therapy, they are eligible to submit work to the gallery. Returning for a Brushes with Life show at a local restaurant are 8 artists who represent the wide spectrum of illness and inspiration.
Hi, I'm Philip Brubaker. I directed this film, and I have bipolar disorder. It all started when I was 20 years old. I didn't know what bipolar disorder was.
Bipolar disorder is a biologically based mood disorder where they may experience depressive episodes, and then they may also experience at other periods of time manic episodes, which can kind of be the opposite of that, where they have elevated mood, they may be full of energy and not need to sleep, distractibility in their thinking or racing thoughts.
I reacted in a violent way towards my parents when I was home for Christmas vacation. I was saying things that didn't make any sense, and it was obvious that something was wrong by the way that I was behaving. That night, it was around midnight, and we happened to get a call from California from my mom's friend who's a psychiatrist at Stanford, and we told her what was going on. She said that he needs to go to a hospital.
I regained consciousness in a wheelchair traveling through the halls on the 3rd floor. And I was in such a state of psychosis that I didn't even remember if there was anything on the walls, but now there is art all over the walls. And then I was wheeled into the 3rd floor behind the restricted area, and that was where Act 2 of my life began. And I found that Brushes with Life has just been a wonderful outlet for my creative sides. It's also helped me overcome the stigma of having a mental illness.
The real power of it comes when you actually leave and you walk out of that hospital and you see the artwork all over the walls, and each piece of artwork is a success story. Because each piece of artwork says, I was a patient here, and I made it through, and I'm okay now.
I hate the words mental illness together. It really ticks me off because I'm not broke. People have cancer. You don't go around and say they have cancer illness. And so pain can be the catalyst for beautiful things. That's called Self-Divided, and it has about 14 parts, pieces, torsos of the female body. Somebody'd have to give me a lot of money to sell that one. That one is very important, and it represents a lot of healing from a lot of pain. I'm an abuse survivor, and parts of me that could be broken and they could be severed for a while, but I will make my connections.
Post-traumatic stress disorder is when someone's experienced some sort of trauma and they continue to have repercussions as a result of that. In the form of they may have nightmares or reliving episodes where they're sort of reliving that prior trauma.
As I know women, that they often feel like they are only body parts and pieces, whether they live with quote-unquote mental illness or not. I think a lot of us could not function without the ability to create. So many people want to throw us away, and that really pisses me off.
I want to talk a little bit more about schizophrenia.
I'm diagnosed as schizophrenic. I guess paranoid schizophrenic. And what do you want to know?
Schizophrenia may include things like hallucinations, hearing things or seeing things. It may include distortions in their thinking, such as having delusional thinking, where they might think something's real when it's not, or confusion in their thoughts or their behaviors.
Well, it's not like, most people think of like crazy schizophrenic as like, you're just out of your mind doing crazy, stupid things, and they always have like horror films and stuff like escape mental patients and things like that, So I think that the world looking in is like kind of like judgmental of me. Brushes with Life sort of started me on my public display of work. I don't really have the money to buy the canvases because they're expensive. I use cardboard to do bigger works on. This was a nice one, I think. I did this while I was watching the Three Stooges. It's like I think it's upside down actually. Creating something is a way to get the illness out of you. When you're painting, it's sort of like a distraction from everything else, It's just sort of lose yourself in the moment and just go with it, Just do whatever comes to mind, and it's just like freeing you. It's kind of helps you work things out. You could say it's like a window into the soul. At the hospital, I talked to some psychiatrists, I guess, and I guess I said the wrong thing. I don't know what I said, but I went back to school the next day. They had me go into the counseling office, and I talked to them, and I told them about the drugs that I was using, and they took the police came in and took me away in handcuffs to Dorothea Dix, and that was the first time I was hospitalized. It would be nice to have recognition, just more than money, just like, people like coming up to me and saying, hey, I liked your painting. I'd say the art is better medicine than the medicine is.
Yeah. Currently, Todd Emmerich has a show at the Acme restaurant downtown, Carborough, which is a great show. And he just gave me this poster he created advertising the Acme Tomato Festival. So, is that beautiful?
So tell me about the Acme Tomato Festival.
What do you know about the Acme Tomato Festival?
I know that you designed the poster for it.
Yeah, I did.
So tell me about it.
I don't really, I know they like tomatoes there. I'm on disability, but I do make some money from my art.
This friend just wanted to paint a picture of her dogs. Somebody saw it, or she told one of her friends that said, hey, he does some good dog portraits. And so I've done quite a few of them now. I guess the last time I had problems with like any sort of mental illness at all was in 2000. And then I pretty much couldn't draw or paint. I was real bad off. It was kind of like ridiculous. I was obviously crazy and schizophrenic. I was really depressed.
Depression is, again, a biologic disease. It's a chemical imbalance that causes changes in someone's mood, appetite, energy, concentration and focus. They can also have be plagued by kind of guilty feelings or low self-esteem. They can have suicidal thoughts.
I mean, to anybody with any kind of sane mind, they would say, well, he needs some help, obviously. I have some drawings I did from the time. I had several books, and I did a lot of them, but they're all like really scratchy pen and pencil drawings. There's, you know, different types of realities. Everybody's is different, really, but there's also like a collective sort of conscious reality that everybody experiences. And for a while, I wasn't aware of the fact that there was something that everybody experienced. If I had not had it to work on, if I had not had it to focus on, I probably wouldn't be around. Anything you can imagine, you can put it down on a paper or canvas. You know, it's great. It's like I said, it's like you know, the best thing in the world. You know.
Van Gogh was sick, great artist. Maybe before, you know, he passed away or whatever, he was recognizing he was going to achieve greatness or something. So I heard he didn't start, if I'm right, maybe late 40s when he started painting. No, I'm not. I'm not in my late 40s. I'm in my early 30s. Well, I've always been interested in art. You know, it's about the same age I was interested in playing basketball. I kind of went off the edge, you know, almost after, a little bit after high school, went to college. My mom and dad kind of picked up on it, and I was, you know, placed in an institution. Since there was no future for me in basketball, art is something that I, you know, was taken as a hobby. You know, now it's like I want to try to change it to like a way of life. A lot of things make me mad. Living in general. My mom's boyfriend burned my hands while she was at the stores. Now it's, you know, of course I'm older now, but now it's more as, you know, I really don't care what people think about my hands, you know. You know, I don't have any angry feelings towards them. It's more of, you know, why did he do that? You know, people can, you know, see your hands or whatever, and you know, a lot of people don't even mind that. I would say having a mental illness is way more tougher than my hands being a problem or whatever. Well, hopefully, you know, maybe a lot of people will get to see my art sometime. Appreciate it, hopefully. Maybe the next 5-10 years, hopefully, a lot of people will be able to see some of my artwork.
People with mental illness sometimes have a hard time socializing. I was just sitting there thinking, well, do you have social anxiety, or? Maybe I'm just getting shy right now. I was diagnosed off and on from age 14 till 18 with depression. And then when I was 19, and that's when borderline personality disorder came into the picture.
Sort of poor self-esteem, feelings of emptiness. They may also have impulsivity. They may have self-injurious behaviors. They may get involved in chaotic kind of relationships with other people due to some instability in their sense of self.
I'm like obsessed that somebody doesn't like me or something. That's another characteristic of borderline. But then I could just do a collage and get my mind off of it. I'll be all right. And then, of course, I've actually been able to sell stuff and exhibit things that I wouldn't have before without the gallery, too. So it's been a positive experience. It's been good. I love it. I'm showing them the clubhouse. We have jobs in the community that members go to. Like we have Carolina Fitness, YMCA, Staples, UNC School of Social Work. We have members that do those for 6 to 9 months, and then some other member goes and does them. Everybody helps each other. Hey, hey, Furball. And becomes friends and stuff, which is good. Hey. Hey, who is that? Say hey. This is my apartment.
Well, tell me what you have in front of you there.
Okay, this is the Club Nova Stargazer Gazette that I edit. And each month I try to give it a focus. And this month I gave it a focus on creativity and mental illness. Shall I read to you? Some of the changes that happen in a manic state, for example, are related to creativity. Many artists and writers have periods of inspiration when moods lift, thoughts quicken, and there are loose connections which allow for creative productivity. Artists and writers suffering from a depressed state sometimes feel helpless. The way out of this mood can be a creative endeavor. Well, I had a psychiatrist in Kansas that told me that when people just listened to radios, it was the radios that told them to do things. When TVs came along, it was the TVs that told them to do things. And when computers came along, it was the computers that told them to do things. I got inspired. I took a Doris Betts writing workshop. Hi. Hello. And she said I should send some of my prose poems out. Imagine robots on skateboards bumping into each other's shadows. It's we I speak of on our appointed hallway for at least 72 hours. Lips chalky with medication, arms stiff from side effects.
Would you mind saying what your diagnosis was?
Schizoaffective disorder.
What are some of the conclusions you had?
That the government is coming to get me and my family and destroy us and things like that. Yeah.
Well, in a way, that's true.
I thought demons were involved in my spirit and trying to overcome my way of being on the earth. People don't really pay attention to these crosswalks. You have to walk right in front of the car before it'll stop. I've been doing really well on my medication for about a year now. Very stable. Yeah.
At this time, I'd like to invite Mike Dunn, one of our poets, to come up and read his poem, which is featured on the program tonight. Mike?
I am but a jar of clay, molded and scolded, prodded and trodden, broken beneath my Maker's feet. Yet the dross remains, though it might cause pain. Into the kiln I go again, to face the fire that purges sin.
When I was 27, I started to sense a power around me, and I wasn't sure it was God. But I said to God, I'm going to fast until you show me what's between you and I. And I fasted for 5 days. I didn't drink or eat. Not too smart, no water, nothing. And I had my first psychotic episode. And that began 9 years of pretty severe suffering. And it ended in '98 with the worst of my suffering, which was on the tail of a psychotic episode. I hadn't slept in 3 days, and I got in my car and drove north. Ended up being pulled by the cops in Maryland. He took me to a hospital, but I had no insurance, I had no disability. So they shipped me off to a state institution. And they didn't have any room in the regular psych ward, so they put me in the forensic unit with criminals, some murderers. And I took the doctor to court and won my liberty. But he put me on the street with nothing. And I was homeless. I had to finally, to keep myself alive, steal some drinks from convenience stores, and eventually found a hospital. I found one shelter
And one man bought me a meal, so I think I ate twice and maybe, I'm not sure how long I was out there, 10 days, maybe 2 weeks. And I found another hospital, and that was a state institution. They shipped me off to a state institution. I call it the Tombs, a room without a window, about 7 feet by 5 feet, a bed. And, I was there for a month. The doctor wouldn't cooperate with me, so I wouldn't cooperate with him. And after a month, he came to me, and I wouldn't speak to him. And he said, I want to talk to you, Mr. Dunn. And I looked at him, and he said, about your discharge. And I said, oh. First words I'd spoken to him in a month. But I haven't been hospitalized since that '98 Odyssey, and my life has been put back together, largely. Another person had told me that she liked me. Wasn't sure I really wanted to get involved with anybody.
I liked him before he liked me. So.
But then he came around.
He came around.
We're on the book committee together, and she came up to me and gave me an invitation with another fellow in the group to go to the beach.
We started swimming together, and we just hit it off right away.
And she turned out to be a really sweet person.
We know when each other is having a hard time, and we know how to deal with it. We don't get scared or anything.
And she's the most tender woman I've ever met.
We've been really happy together for about a year now, and we decided, he asked me to marry him on Christmas, and I said yes. We just made a commitment to each other, and he's the love of my life. I couldn't ask for anything more out of life.
Have you and Mike ever talked about adopting a kid or anything?
Maybe in the future, down the line, not right now. We decided not to have children because we don't want to pass down schizophrenia.
Who says clay cannot thrice be baked? Surely, you say, the jar may break. Indeed, says the potter, that is my intent. For clay once baked cannot be bent, but must be broken, though the shard shall prick my scarred hand. The mere sight of it will make me sick. Is there yet not another way than to destroy this precious little jar of clay?
Was there a problem that I wasn't there or anything? They should know I don't stay for very long for those things. I much prefer solitude than being buddy and laughing. And I don't want to wear a name tag when I walk in, so crazy person's art there. I mean, I don't mind participating and having my art up and stuff for all that, but I just don't have any desire to be singled out as a crazy person that does art. I mean, aside from this film right here is sort of that exactly.
It's changed the way people think about people like me, people like us. And that's important. Not to just be in an office and practice, but to be out in the world.
I don't know if I have anything to explain anyway. I mean, it's just, I just try to make them look good.
Philip is now going to introduce the movie and tell you a little something about it.
You see things at the Brushes with Life Gallery that you don't see anywhere else, and it's really authentic. I got my interest in filmmaking back because before I was hospitalized, I was in film school, and I crashed. I had onset of bipolar disorder, and I slowly got my footing back, working my way up from photographs to film again. So it's been terrific. I just want to first off dispel the myth that mania is great for creativity. It's not, because when you're manic, you may write a 10-page story or something, or you may write some music, and it may seem like it's awesome. But then if you just wait a couple days, get some sleep, and then look at it again, you're like, this is crap. I mean, this is no good. So I really think you need to have a balance between meds and your passion, bipolar energy, whatever it is. And you got to fine-tune that balance. Pretty soon people are going to be admitting themselves into the hospital just so that they can get in the gallery.
You don't have to do that.
I think that I think it's going to be there in the hospital surely for a long time, if not the rest of time itself.